Hello friends, update in the Cochlear High Drop saga. If you remember, October 17th, it came back. The pressure, the distortion of sound, the low frequency hearing loss all came back on October 17th. At that time, I was only taking the diuretic. Because it came back, they put me back on a steroid and they sent me to a neuro-otologist, Dr. Wyatt in Winfield, who's a brilliant, amazing man. And he spent some time with me, gave me a lot of information, a couple things, of course, a low salt diet. We already knew, I already started that. Another option is a beta histine. I hope I'm saying that correctly. That would be an off-label use. So that is not FDA approved for the treatment of cochlear high drops or Meniere's. However, it has shown to be effective in about a third of patients. So I'm not a huge fan of taking medications. I would prefer not to take that, but that's an option. His best recommendation is a steroid injection. So essentially, I lay flat on a table, they use a needle and inject the steroid directly into my left ear. That could be one injection or it could be 3 injections over the course of 10 days, and that has shown to be more effective. It could be that in 4 to 6 months I need it again. We don't know, right? There's no guarantees with this. So those are kind of the things that I learned. We did talk a lot about stress. So it's cochlear high drops is very correlated with high stress. I am a full-time employee. I have 2 kids. I have a husband. I have a household. And then on top of that, I have a side business of a travel agent. So yes, there are lots of stressors in my life for sure. And to add to those stressors, and we're gonna get close, you're gonna get to know me a little bit better here. I'm in my mid-40s and I am experiencing symptoms of perimenopause, woohoo! And so, you know, I'm not sleeping well. I have crazy mood swings. There's a whole list of symptoms I'm not gonna go into, but that is certainly adding to the stressors in my life. Now, I do have an appointment with a menopause specialist in December, and so part of me is wondering, could I just really focus on relaxation exercises, reducing that stress, trying to get better sleep, taking things off my plate and giving it to other people, and of course the low salt diet. And if I do those things, would it help to where I wouldn't need to take medication or get an injection? I'm a baby. I hate needles, you guys. Like, I can't tell you how much I hate needles. So the thought of laying flat on a table and a needle going into my ear and injecting a steroid that's gonna make me dizzy for about, you know, a half hour, you can't swallow for a half hour, that just sounds awful. I really don't wanna do it. If I was talking to someone else, if it was a family member, I would say it's no big deal. Like, there's very little side effects. It's quick, it's 30 minutes tops and you're done. But I hate needles and I don't wanna get an injection in my eardrum because I'm a baby. So part of me is like, what if I just really focused on the diet and the relaxation exercises and getting better sleep? Could that take care of it to where I wouldn't need to be on medications or steroids or anything for the rest of my life? Like, that's what I would prefer to do. I'm wondering what you guys have done in the past. What are your thoughts? What do you think I should do? Right now, I'm in a holding pattern because I can't make up my mind. It's a big decision. And everything's going well right now. And granted, I know I'm still on the steroid. I have 1 day left of the steroid. Tomorrow will be my last day. So then we'll see how long it lasts after that. I'll be on the diuretic for a while, I know that. But I'm really hoping some lifestyle changes can make a difference. Let me know your thoughts. Thanks for listening, friends. Bye-bye.